Hi, everybody. Thank you for joining. We will give it a few more minutes here before we get started.
Oh.
Hi, everybody. Thanks for joining. There's still a bunch of people joining the meeting, so we'll give it a few more minutes before we officially get started.
Good afternoon.
So I just want to let you know that my unit has an outbreak of COVID.
All right. So I think we can get started. It looks like most of the group is here. But thank you, everybody, for joining today. If everybody could just make sure that they're muted throughout the presentation. My name is Kaylee Lochran. I'm the program manager for Matters, and I'm here with a couple of my colleagues today. So I'll pass it off to Katie. You're muted, Katie.
Good call.
There we go.
I'm Katie. I'm the Director of Operations for Matters. Thank you all for joining us.
And I'm Josh Lynch, the Medical Director for Matters, and thanks for joining us.
All right, great. So I will share the presentation. Dr. Lynch is going to kick it off. Anybody who has questions, feel free to either put them in the chat or unmute yourself throughout the presentation. We'll also have plenty of time at the end to go through questions. So either way works for us.
I think putting them in the chat might be easier as far as logistics goes, just because there's a lot of people on here. Also, it's on multiple screens, so raising your hand, we might not see all either, but what we can easily do is watch the chat. So if you don't mind throwing those questions in the chat, that'd be a huge help, but please feel free to fire them away. So Kaylee, thanks for putting this together, and we're really excited about the opportunity to work on this project. We're actually recording the presentation, so we'll be able to share a link. So you'll be able to get the information after, share it with your colleagues. So thanks, Kaylee, for putting this together. We're excited at the opportunity to be working on a project like this. It's something we've been thinking about for a while. And if you're familiar with the Matters program, we try to kind of fill gaps where services are needed, and kind of continuing on some of the harm reduction supply distribution work that we're doing. We thought this would be a good use of our resources, and would also allow patients one more level of access to, one, get supplies to keep them safe, but also have the opportunity to access the power of the Matters network to get linked up to treatment. Just before I start, I would like to thank OASAS for providing the support for this program to start. They are contracting with us so that we can make this possible. So as probably most everyone on this meeting knows, not every patient is ready for full-blown treatment and everything that includes right from the beginning, and maybe not even ready for some of the services that the Matters program offers through our suite of resources. So we have been kind of piloting a fentanyl test strip distribution program over the last couple months, since really late fall, and that has been very successful in getting fentanyl test strips into the hands of hospitals, treatment organizations, EMS providers, and also directly into the hands of patients. We will be ramping up in partnership with the Department of Health distribution of naloxone in the same way. And just to keep in mind that in no way are those efforts meant to be in competition with any other treatment organizations operations, but really more to reach some of the people and patients in the hardest to reach places and corners of the state. And that's really kind of where in part where we got to the harm reduction vending machine concept is we've seen through talking with patients that are referred that either are successful in getting to their appointments and also not successful due to whatever barriers, putting supplies out into the community where patients can access it easier, or access it in a way that they don't necessarily have to divulge a lot of their personal information or go into a hospital that could be overwhelming for whatever reason.
Right.
Where we came to this project. Go ahead.
No, and that's fine. It's going to take two.
So we are really the whole point of today is to kind of give an introductory, just brief walkthrough on how we envision this program working. We have the ability to distribute harm reduction vending machines to anywhere in New York State, and we're looking for partners to come out of this discussion that would be interested and willing to partner with us to operate a machine in conjunction with their treatment organization. Go ahead. So Kaylee will talk a little bit about kind of the process that we have envisioned. Just keep in mind as you're listening to this, that the exact kind of intricacies of the process may change slightly. This is the proposal that we have now, and this is how we envision the program operating. So if you have questions, please put them in the chat. Kaylee will take it from here.
Great. So real quick, we'll just walk through operationally how somebody would utilize the vending machine. So they would first call the Matters team, the main Matters number, and they would have to register as a vending machine participant. We'll walk through a short questionnaire, get them registered, and they will be given a unique ID. This will be completely anonymous, so they don't have to give their name, date of birth if they're not interested in doing so, but they will get a unique ID that they utilize each time that they want to use the vending machine. So they'll enter that ID into the vending machine, and their items that they wish to receive will be dispensed. Each participant will also be allotted a certain amount of supplies at given intervals, and that'll be linked to that unique identifier that they're given. Next piece here, what supplies will actually be offered in the vending machines. So we will definitely have naloxone and fentanyl test strips. We're also exploring the addition of syringe supplies, so more to come on that. I will pass it over to Katie to talk a little bit about location.
I'm just reading here that something popped up in the chat here.
Yeah, Dawn, we'll be happy to address that in just a minute. Thanks.
So where will the vending machines be located? So obviously we want to put them anywhere that is accessible, easily accessible to our target population. So keep in mind, vending locations may not necessarily be at a treatment organization. Right outside of a facility that's offering those things might not be the ideal location for them. So the idea is that we would partner with people to sort of work through what that looks like and see exactly where we think the appropriate location would be. So partner responsibilities, purchasing the vending machine and other setup supplies. So there's going to be a slide later on that shows sort of the breakdown. There's going to be a temporary upfront cost that will be reimbursed in a timely manner. Monitoring the machine's supply, restock as needed. Those orders will be placed through Matter's website for additional stock. So you'll just order it right through us and then we'll send it over. So as far as what the Matters team is going to be doing, we will be responsible for registering the participants, like Kaylee said, to obtain the supplies, sending the naloxone, fentanyl test strips to the partners as the orders come in from you guys. So I know this is probably what everybody's wondering about is sort of the cost breakdown. So here's just breaking down the cost, the machine, the software that you need, the warranty for it, the cell service. The electrical installation may or may not be needed wherever we decide that we're putting them. And then if storage is needed, we've allotted money in there for that as well. So it's anywhere from like $16,000, $18,000. And again, you're going to incur a temporary upfront cost and then it'll be reimbursed.
So I'll address some of the questions that are coming through on the chat. So in regards to the supply, the machine and the associated other elements of the order that Katie just went through on the previous slide would be ordered. And as far as fentanyl test strip and naloxone to stock the supply would be sent directly to the organization that would be kind of hosting that individual machine. So in looking at the time it takes to stand this up in a community, really the bulk of it is placing the order and waiting for the machine to be delivered. That's a couple month time frame. That will also allow us to kind of work directly with the organizations that are participating in working out kind of more of the details that might vary site by site. But either naloxone will be shipped directly to the organization or we will ship it out initially, and then we will work with you to make sure that your kind of back stock is maintained so that the machine doesn't have a likelihood of becoming empty for any prolonged period of time. Michelle's question about Matters becoming a syringe service program. We are working with the Department of Health on a syringe service program application and have a variety of ideas as to how to appropriately distribute syringe service supplies. And that may look that there are a variety of components of that may include things like mailing them to patients, including them in the vending machines, and a few other concepts that we are working on kind of through the application process. Candace, yep. So the regional care coordinator and or the organization associated with that, OASAS is a combination of OASAS and through the Matters program will be covering all the costs associated with the machines, the supplies, the electrical installation if needed, a storage cabinet, and the supplies that go into the machines. So Stephanie, the agencies, there really should be no out-of-pocket expense for the machine and or the supplies that would be placed in them. So yes, the 18,400, if you need the full cost of the electrical installation and cabinet, would be reimbursed. So in regard, just taking Tim's question about a 5 to 6 month delay, it is several months. We will have a better idea of that once we select partner organizations and actually get ready to place the orders. So if you're a syringe exchange program already, can you add syringes to the vending machine? That's something that we can talk about offline on a kind of a location by location basis. There are some other requirements legally and through the Department of Health syringe service program as far as kind of approvals or potentially modifying your application if required. But I think we certainly would be happy to have those discussions. I think it's a great idea.
Can I interject for a second really quickly?
Yep.
I just want to clarify. So partners who are unable to cover that cost up front, we are working with Oasis on another option so that you don't have to incur that cost, but get it reimbursed. So Amanda, yes, the entire, whether it's 16,400 or 18,400 would be reimbursed.
And
I just wanted to clarify my question. My question about like registration in terms of if somebody were to call and request that number, they would be calling kind of the Matters number, not the RCC's number directly to provide that.
correct.
Got it. Thank you.
And then the next question I can answer, it was which model and brand we're looking to use. So we are looking at intelligent dispensing solutions, and the model is SD5000R. So that's what we have the quote for, and that's who we're looking to order from.
It's the outdoor machine.
Yes.
Yep. So great question. The last question is great. So there will be the machines will be wrapped with information with a phone number, with a QR code, with a couple other resources kind of on the wrapping itself. And then also the ability to download the Matters app and or a QR code so they can request being referred to treatment. And then any supplies that are distributed out of the machine will have either educational materials attached to them or in a bag with them, or a QR code taking them to a website that will provide education. It is a regular vending machine size. We are looking at about 12 to 15 machines out to be distributed across the state as kind of a pilot project. So we don't have a specific regional requirement per se, as far as one has to go here, one has to go here. We will take in a variety of factors, looking at what the organization looks like, what their logistical capabilities are, the locations, and then also kind of looking at some of the other programs that are doing similar work, so that we're not, tripping over ourselves or stepping on other people's programs or machines. So if the program is not on the first floor, this wave of machines is geared towards outdoor use, and a next iteration of the program could potentially include other machines that might not be outside. Drew, this is this is the summary of the program that we are able to share right now. I envision us kind of working on a one pager, highlighting the program once we have a few more of the logistical details hammered down. We may not have all of the efforts today, all of the answers today specifically. We wanted to get out in front of interested partners so that we can share the program, solicit interest, and then have some discussions or, organization to organization about kind of how this really would look, in your area. So just looking at, so I think we had answered this question about programs that have no funding. We are working on an option. So our goal is that if an organization is not able to cover the cost initially for a week or two while we get a reimbursement worked out, we're working on a way to avoid that for you. So great question about the no access to a phone. This program is not perfect. We understand that not every single person will be able to be reached with the vending machine model. Monitoring stock, ensuring restocking on a timely basis. At this point, there has to be a technology component to it. There are other programs across the state that are able to get Narcan and fentanyl test strips into people's hands. I'll just kind of speak a little off topic, but allowing individuals that don't have any access to a phone, either personally or access to a phone in any other way, that's a struggle for us and probably everyone here. And it's something that we are mindful of, and we try to be as respectful as we possibly can. And those individuals have a harder time than probably most others. So I don't have a great answer to the question about how do people use the vending machines if they don't have a phone, other than perhaps using someone else's, or if there's a phone inside of the organization that may be hosting the machine, that may help.
I'm just gonna jump in real quick, Dr. Lynch. Juliana, do you have a question? I know you've had your hand up for a while.
I do, and I'm sorry, I'm on my phone, so it's hard to type and do it. So when you mentioned that there would be a unique ID for each person, so two things: if the person doesn't remember that number, are they able to call and get another one because it's a de-identified number or ID?
Yeah, so we haven't worked out all of the logistics of if they forget their number or what happens in situations such as that, but we will definitely have a way for them to re-register with the program with a different number, or some sort of recovery process for that ID.
So
Thank
looking
you.
at, oh, sorry.
I was just saying thank you.
Oh, sure. Thanks, Julia. Looking at programs about access to Narcan and fentanyl test strips that currently exist, and also taking into account geographical overdose data, access to treatment data. Those are all kind of being taken into consideration about kind of where we try to figure out where to put the first round of machines. So we wanted to have this discussion first while kind of we decided let's do this today instead of waiting another few weeks while we continue to work out some of the other finer details. Most importantly, we wanted to find out who was interested. And I think I speak for the whole Matters team that we're thrilled that there was so much interest here. So this is really the first step.
Eric's question about how do you order the machine? So I believe Kaylee's last slide said, did you put up, I think it was within 2 weeks is maybe the deadline for going on the website, and we're gonna get a form up where you can.
Yep. So after today's meeting, we're going to send out the slides and also the recording of this meeting so everybody can take a look at it. And it's also there for anybody from your organization who wasn't able to make it today. We will have an interest form on our website. So any organization that is seriously interested in managing a vending machine in their area can fill that out. We'll get in contact with you and talk through the logistics, one of the questions on there will be the location that you would like to put the vending machine. We also ask for pictures. If you happen to have pictures of that location, that would be really helpful for us as well. And then we will be in contact with you. The deadline for letting us know if you are seriously interested in managing a machine is 2 weeks from today. So I believe that takes us to the 25th of January. And then if there's any additional questions that you have in the meantime, definitely feel free to reach out to myself and I can get you the answer to any questions that you might have.
So I'll work on a couple more questions here. There certainly will be a focus on areas that have less resources. And the syringe services program is really kind of, will be a phase 2 or 1.5 to this program. So you're looking at access to naloxone, overdose death data, or non-fatal overdose data, and kind of other general resources that are or are not available. It would certainly be taken into consideration. The age limit on the machine, I don't know that we have that completely firmed up to answer today. It is anonymous and we're not collecting patient names when someone is getting a unique number. So a unique access code to be able to access the supplies. So I don't have a solid answer on that today. My apologies. If someone's using the Matters program to get linked up to treatment, is there a way to sign up for this during that process? So as it sits today, the obtaining a unique ID is just that for right now. We obviously want to make sure that while we're engaging that person and giving them an ID, as you know, really the roots of the Matters program is linking people to treatment. So if there is a way to tack on a referral or engage the individual in a kind of a more deeper way, that is certainly something that obviously we're passionate about and would do if possible at the time. Sorry, just working through this. So yes, part of the responsibility on the organization is to monitor the volume, basically monitor the stock for us. We have excess stock. We will have excess stock both at the Matters office that can be sent out quickly, and also can order you more supplies directly from the manufacturer and can be sent directly to you. So we'll kind of work and kind of pivot between those two resources. But really, we need the partner organizations to kind of take ownership of that specific machine in watching stock. And there are some analytics about this is why there's a cellular connectivity and looking at what type of supplies are withdrawn, what time of day they are, what time of week they are, if other things are happening in the community. That's really the point why these are all connected. And I think that's really will be a really interesting part of the program, is to look at some of the data about, what time of day are certain things accessed, is one unique ID, what is that unique ID withdrawing, are there patterns? And I think this will be a model that hopefully could be used in other parts of the countries too, about setting up a statewide harm reduction vending machine program.
Sorry, I have another question that I can't type. You had mentioned there was an allotted number of supplies per person. Is that like per day, or like how is that monitored, or what's the allotment?
I can take that one. So we haven't completely defined that process yet. We've been talking to some other states that have implemented a similar vending machine project. So we'll probably talk to those partners to kind of get a good idea of the volume that they see. So that hasn't been completely defined yet.
And correct me if I'm wrong, Kaylee, it's more so just to prevent, somebody from coming up and, unloading the whole machine.
Correct. Yeah, exactly.
So looking at data sharing, there will be kind of multiple levels of access to the analytic, or like to the data set. So from what we understand, technology wise, the organization that is hosting the machine would have a user or two that would be able to see that machine's activity. And we will work on kind of defining and setting up the steps of how you get access to the dashboard, how that works, how that looks. Some of that is one of the kind of many details that will be worked out between the time of ordering and the time of actually the machine arriving and being installed. And it was obviously brought up later, and it's no surprise to the group that that this is a couple month delay in between placing the order and having it actually be delivered. Looking at if there's more orders than availability of the machines, how will the vending machine distribution be prioritized? And I think we touched on this a little bit, looking at resources that are or not available across the state. It's going to be a lot. There are a lot of factors in trying to figure out where the best places to put the machines will be. Again, this may not be perfect. We really want to try to get these placed in the best locations that we possibly can, given a variety of factors. We don't have 100 machines, so you know, our plan here is to get them in the most highly effective areas, demonstrate that this project works, that it's effective, and then continue to grow it. I think we addressed
I'll address, there was a question, I was trying to stay up to date in the chat, but there was a quick question about if somebody is already accessing like services through New York Matters, whether it's a referral through the platform, telemedicine services, whatever it may be, if they can also get an ID that way. Those finer details haven't really been figured out yet, but I don't see any barrier to them, you know, registering for the vending machine project while they're also receiving some other services through Matters. So that'll definitely be offered to them.
Do you know when there will be more information about Oasis helping out with the upfront fees? Like, will that be before the 25th that we know more about that?
I would encourage anybody who's interested to at least submit the form to us, even like if that's on your mind, like that's something that you need, still put through that you're interested, so we can put you on the list just in case we don't have the details by then. I don't want that, don't let that sway whether you are deciding to submit the form or not. If you're interested, please submit the form. We'll find a way.
There will be an opportunity to indicate if that is a barrier or not on the form. So if it is, just simply check yes, and that will not influence, the decision on how these get deployed geographically.
Okay, thank you.
So the kind of the timeline is once we receive all the forms in 2 weeks, I imagine it will probably take a week or two to really kind of sit through, and we want to make sure that we're deliberate on where these are deployed, to make sure, obviously that they're in a high yield areas. I would anticipate that being a week or two. The software is proprietary to the manufacturer and it comes preloaded on the machine. So I don't believe in this round of machine kind of deployment that other software programming is an option. Outside additional software or different software programming is an option for monitoring. And on the terms of this grant that do not allow for a lease option. And Kaylee might be able to address Candace's question about the distribution of the invitation to this invitation.
Yeah, so we sent it out to all of our partners.
Thank you. I was just thinking in terms of some outreach efforts and not wanting to duplicate that, who may have already been contacted about that and potential spaces. Thank you.
Yeah, and also, when we send the information out after today's meeting, anybody who you think might be interested but missed today's meeting, feel free to send them the slides and the recording. This is open to everybody.
Timothy, just your question made me think of something else. So the machines would become property of the organization that is partnering with us. New York Matters will not own the machines. The organization will own their own machine. So we anticipate this program to be supported for a 3-year time period. looking at supply restocking. We have had discussions and have already thought about if the organization decides that they can't participate anymore within that time frame, or at the end decides they don't want the machine. We're working on provisions about either disposing the machine, which would not be the preferred option, but also relocating to another site or a different treatment organization. The codes, Kaylee, will the code be unique to the specific machine, or will it be able to be used in the machine within the network?
Yeah, that's a really great question. I'm thinking that the codes will work on any New York Matters machine, but we will definitely have to solidify that answer and make sure that is the case.
So, Stephanie.
And
great-
sorry, Dr. Lynch, you said this was how long, how many years you're expecting this to, for supplies?
This is we are planning on this being a 3-year supported program for supplies.
Okay.
So Stephanie, our intent is to provide the supplies, i.e. naloxone and fentanyl test strips, to the partner organization so that those supplies can be used into the machine. We are not asking agencies to go out and try to secure their own fentanyl test strips or naloxone.
No, that's not my question. My question is more specific to, for example, if an agency gets supplies and has its own kind of like, cadre of individuals who are getting treatment at that location, one would imagine that those individuals would have supplies. In this case, with the vending machines, I'm just thinking that strategically, wouldn't you want people to access supplies through more like community organizations, places where they wouldn't necessarily have access, to be more strategic in how it could meet the needs of people who are not necessarily connected to services?
Sorry, in my attempt to rapidly read the questions, I might have skipped over that detail in your question. So it was mentioned, maybe a little too subtle on one of the slides, that placing a machine outside of an organization that already offers naloxone and fentanyl test strips to individuals that walk into the organization or are affiliated in other ways with that organization, that the machines might not necessarily be best placed in front of an organization that's already doing this. So when on the form you will see a field with the address of your organization, but then a second field asking for the address of the proposed location. We would recommend that it does not be in front of an open front door where someone could walk 10 more feet in and get the supplies that are in the machine. We think, I think that's what you were getting at. Yeah, okay. So yeah, of course, the data that we collect on how these machines look will be kind of available to the group and really shared as part of the Matters resources, that how this program is working and how what types of supplies are being distributed where and what time of day and at what volume. So yeah, so Lisa, for this project, these machines are geared towards being outdoors. There's a separate model that is for indoors. A separate model of the machine that's for indoors. Kaylee, you want to take Dawn's question here about demographics?
Yeah, so we will definitely collect some sort of demographic information. I apologize again. We're still working out those finer details on what that initial screening / phone call looks like, but we will share the details of that very soon.
So there are a total of 12 to 15 machines that will be available for distribution across the state. We would love to give each organization 12 to 15 machines. We're just not quite there yet. Dean, you had your hand up?
Yeah, so I apologize. I came in just a few minutes late in case I missed this part, but you just talked about on the form having a proposed site. So my particular program is Narcan distribution. We've all over the state is where we distribute. I got trainers that volunteer, which is a huge thing. I also live in central New York and small farm communities all around. I work for a SEP and we're mobilized. So for me, my thought process is I need to know that I got a machine coming before I can hit some of these rural areas to say this is really where this machine's gonna do best and reach the people we can. So I guess that's, maybe I missed that, like I said at the beginning, is that something you need right off the bat to know where about, or just kind of the general area?
So if you have a location or a couple locations in mind, we would encourage you to include that on the form. I think, priority number one here is organizational commitment. And, priority two is the exact, would be the exact address of installation. It would be helpful to us if you could describe those potential locations. And as Kaylee mentioned, if you can include just a picture of the proposed location and giving us some context geographically, would be super helpful. I understand that, looking around the community and trying to help decide where the best location would be might not be something that is ready to be decided today. But hopefully after today, you're thinking of some potential places around your community or for a little further out that might be good. That might be good places. And I think that, that hopefully you'll be able to use, the next week to 10 days to kind of further identify some of those spots to see which might be the best.
All right, perfect. Thank you.
Yep.
Any other questions that we can answer? So it is a 3-year commitment by the organization, yes.
So we would ask that you just give us the rest of today and a little bit into the morning to get the form up. We've got our wheels are turning on the questions you're asking about making sure that the form is effective. So we're not sending requests for more information after. We want to try to use your time efficiently. So when you fill out the form, we're in good shape. So I would check back tomorrow, like lunchtime, for the form to be up. But in the meantime, we'd ask you to really seriously think about where the best site in your community might be. You know it better than we do. That's why we're all here. And I just want to thank Kaylee for putting this program together, and really all of you for taking a little time this afternoon to think about working with us in a little bit different way.
Alrighty, thank you, everybody. Have a good rest of your day.
Thank you.
Thank you guys for everything you do.
Thank you.